1. Whether it's security or connectivity, Afghanistan is now a focal point of world powers and regional leaders. What are the constraints for India to be part of Afghanistan peacekeeping accord? At present, what should be India's role in Afghanistan? GS Paper 2, Bilateral and Multilateral Relations Involving India. Raising strategic significance of Afghanistan. It is no longer possible to see Afghanistan in terms of a line from Delhi to Kabul, but as a center point of many strands of connectivity and energy, with each strand held by a different world power or regional leader. Afghanistan has gone from being a landlocked country with limited options to a country at the center of many plans. So if India wants to build on the potential of the Chabahar, it needs to find its own voice and speak clearly about the security in Afghanistan. It is not only time but also necessary for India to clearly define where it stands on all of this. What are the constraints for India to be part of Afghanistan peacekeeping accord? There exists an ideological difference with Taliban. India has been ideologically an opponent of Taliban since its inception. India has tacitly supported Northern Alliance against Taliban during 2001 American invasion and steadfastly backed Afghan government to the dislike of Taliban. India-Pakistan relations and Kashmir issue also have little leverage with Taliban. The U.S. strike on Taliban chief Mullah Akhtar Mansour would most definitely have buried the already dying reconciliation process as well. Retreating Afghanistan government from Quadrilateral Coordination Group might affect India to play any constructive role, as Taliban leaders refusing to come for talks. How should be the India's role in Afghanistan? Due to non-intervention and constructive role in development, India enjoys significant goodwill in Afghanistan. India's role in Afghanistan should be facilitating conducive peace climate for establishing a stable regime which can fulfill the needs and aspirations of Afghan people. India's professed policy of no boots on the ground rules out any active military support. But it can help Afghanistan government with financing arms procurement, training army and police officers. Recently India had finished 3 major infrastructure development works. We can take new projects and execute them timely. This will provide tangible benefits to the people there. While continuing such aid, India should actively engage in Afghan peace process to secure the interest of Afghanistan and the region as a whole. 2. Experts predict that more than 60 million Indians will succumb to non-communicable diseases by 2020. So how can government address this looming health crisis? GS Paper 2, Issues relating to development and management of social sector, services relating to health, education, human resources. Looming of health crisis in India. Non-communicable diseases, NCDs, such as cancer, heart disease, respiratory disorders and diabetes now jostle alongside infectious, communicable diseases such as tuberculosis and leprosy, causing more than 53% of all deaths in the country. Experts predict that more than 60 million Indians will succumb to NCDs by 2020. What should be done? As every investment in combating non-communicable diseases is a means of promoting development, government must strive to avert the health crisis looming on the horizon. Why health crisis is emerging in India? India's public spending on health is one of the lowest in the world. According to the World Health Organization's (WHO) World Health Statistics 2015, India spent 1.16% of its gross domestic product, GDP, on health, ranking 187 among 194 countries. In per capita terms, India ranked 157, spending just $60, purchasing power parity. The per capita public expenditure on health was 55% of Indonesia's, less than 20% of China's, and 11% of Mexico's and South Africa's. Despite being the first country to adopt the Global Monitoring Framework on Non-Communicable Diseases, NCDs, and including it in the Draft Health Policy Action 2015, India's current budget reallocation for NCD programs is a minuscule 3% of the total health budget. Even though successive governments have pledged their commitment to the provision of universal healthcare coverage, UHC, statistics reflect slow progress on this front. The majority of Indians lack access to affordable, high-quality healthcare. 30% of identified illnesses in rural India and 20% in urban areas go untreated because of financial constraints. 85.9% of total private health expenditure in India was paid out of pocket by individuals in 2013. Also, about 47% and 31% of hospital admissions in rural and urban India were financed by loans and sale of assets. Impacts of non-communicable diseases on economy. Huge expenditure by people cost them their livelihoods. Poor people can hardly afford costly healthcare provided in private hospitals. Increased cases of lung diseases, heart-related ailments and diabetes are decreasing the productivity and quality of life of people. Social exclusion for elders and young generation in cases of disabilities and some serious diseases. The poor households would further be pushed to poverty and increase burden on government expenditures. Reduction in young and vibrant workforce. Deaths hinders the progress of the country by losing manpower. A developing economy such as India's can't afford to rely on a single public healthcare financing system to cover the entire population, especially in view of rising healthcare costs and the limited access to private insurance policies. Then how India can ensure wider healthcare coverage? India needs a comprehensive and diverse system of healthcare financing that pools financial risk and shares the cost burden. The government needs to consider a multi-payer approach that includes expansion of commercial health insurance plans and other innovative financing models that emerge out of public-private partnerships. Strategic public-private partnerships between central and state governments and private stakeholders should drive global and national attention to NCDs, attract more funds and promote the establishment of stronger policies. The government can assume an important regulatory role in the private financing of healthcare by assuring the financial viability of the provider and ensuring inclusive coverage to all. Public investment in healthcare, the percentage expenditure of GDP on healthcare, must be raised from the current 1.1% to at least 2.5 to 3% by 2025, at the state and federal level, with a greater appropriation of the budget for NCDs. The new health policy must attract private investment in the healthcare sector through incentives such as tax benefits, underwriting and facilitating bank loans to supplement care in remote and underserved regions.